Hello, my name is Dr. May, the medical director of the Richards Clinic, the pain clinic. Today, I want to inform you that there are things you could be doing that could encourage the arthritis to get worse in your joint. I want to bring 5 different things people do that can worsen the arthritis. Number 1 is negligence. You see, arthritis is a wound inside the joint. And the way our body is made, whenever there is an abnormality in the body always gives you a sign. And the commonest sign the body gives is discomfort, pain. Pain is a sign to tell you that something is going on, something wrong is going on in any part of your body. And you need to find out why. But what happens? Many times we neglect this obvious sign of a trouble. We do not mind because at the early stages the pain comes and on its own it can fizzle out and comes again. But this on and off pain is a warning sign for us to look at for what is actually triggering the pain. But sometimes we do not care. And when we don't care, what happens is that the arthritis will now continue to build up. And as it continues to build up, this warning sign of pain will continue to get worse. So negligence is one major way people allow arthritis to continue to expand and eat into their joints. Number 2 is use of treatment that's known as palliative. Palliative is a kind of treatment that focuses on the symptom, because every disease has a symptom. The major symptom of arthritis is pain. So when you leave the disease and you are treating the symptom, what you are simply taking is known as palliative, because you just want to feel better from this disturbing symptom. You just want to feel better from this pain. What do? You take treatments that will suppress the pain. And when the pain is suppressed, at the back of your mind, you feel that you have done something. You feel good. Meanwhile, while you are suppressing the symptom, the disease is inside there getting worse, building up, eating more into the joint. What else do we do? Oh, madam, oh, sir, the reason why you are having pain is because of your weight. Please go and lose weight. And some of us find themselves in the gym. You begin to do all kinds of exercise, not knowing whether it is even good for your joint or not. So some of us have gone to the gym with the intention of losing weight so that they will feel better from the pain. But at the end of the day, they come back home worse. The exercise they are embarked worsen their symptoms and even damage the joints more. Okay? And some have gone for massaging, what is called joint massaging. And they go to people who are not well trained, who do not have the medical knowledge of how the joint functions. And they vigorously massage these joints, and while they are massaging these joints, they are damaging the ligaments and the tendons even more. And most times, this further damage in the ligaments and tendons continue to add up to the degeneration of the joint and the arthritis. Lastly, some patronize unorthodox forms of treatments. Either they go to where they will use razor blade to open up their skin or their joints, claiming that they are letting out bad blood, that bad blood is responsible for the pain. There's nothing like bad blood. Some have used all kinds of concoctions, both to rub and to drink, with the hope that that is going to cure the arthritis. Now, they do not help. So while we are doing all these things, you find out that the pain continues to get worse. Have you wondered why you are doing everything you needed to do or you are taught to do, but still the arthritis tends to get worse? You might ask me, doctor, what should I do? Very simple steps. Please, when you have pain in your joint, do not assume. Do not assume that you know what the problem is. go and meet your doctor. Your doctor will examine you, and after examining you, that your doctor must send you for a test. He must send you for an imaging test like X-ray, MRI, or CT scan, so that he can have a look inside the joint to find out what is actually generating this pain you are having. And when the tests have been done and there's an evidence of arthritis, what we call degeneration of the joints, treatment that can heal those damage in the ligaments and cartilages needs to be given to you. And that is what is known as regenerative treatment. And you might ask me, what is regenerative treatment? Regenerative treatment is a treatment procedure where we take your blood to harvest the platelet cell inside your blood. Human blood has 3 types of cells: red blood cell, white blood cell, and platelet cell. Each of them plays specific function. The function of platelet cell is to heal damaged tissues of the body. They can do this because they contain what is called growth factors. So when these platelet cells are harvested and injected into the affected joints, these growth factors will be released and they begin to work on the damaged ligaments, tendons, cartilages, and even the bone to restore them, to heal them back to normal. If you can heal this damage in your joint that is causing you the pain, you would have treated the arthritis. Thank you very much for your attention.